We do have joining us today, that is Dr. Abhijith. Welcome, Doctor. Welcome on board. It's my privilege to introduce him. Dr. Abhijith Dham is the founder of Koshish Hospice. His passion and pain of observing patients die a lonely, painful, and undignified deaths in ICUs made his mission to provide the terminally ill with a good quality of life with symptom control. He has also focused on spiritual and psychological issues in end-of-life care and has conducted some commendable work integrating religion, spirituality, and quality of life. He has authored 2 books on the same, and he is currently working on his 3rd book. He also have a special interest in afterlife. He has his MBBS and MD completed from AIMS New Delhi and certificate in palliative medicine from Poland, diploma in palliative medicine from Cardiff University, MSc in palliative medicine, and Indian fellowship in palliative medicine, and a lot of activities involved and a lot of certifications earned by him. He's also the National Faculty and Vice President of Indian Association of Palliative Care. Welcome, Doctor. Welcome over the board, and over to you.
Thank you, Sania. I hope I'm audible.
Yes, you are audible, sir.
Yeah, I'll start off by sharing my screen. Okay, and today once more, we begin by discussing and talking about religiosity, spirituality, and the role that it plays in palliative medicine. Well, this is my hospice in rural Jharkhand. In fact, this was the first rural-based hospice to be started in this part of the country. And I work in resource-poor settings. Having said that, I do feel that the term resource-poor is actually a misnomer when you're dealing with palliative care. Because when you're giving palliative care, you need to understand the concept of holism. So never use the term that I don't have such and such thing, and that is why I can't do palliative care, because you always have something which can help you do palliative care, like you have your sense of compassion. So that helps you do palliative care. So basically, you always have something which can help you to do palliative care. Having said that, there is a saying by George Eliot, and he had said that it is seldom a medical man has true religious views because there is too much pride of intellect. See, over the past century or century and a half, if you prefer it that way, a century and a half before, religion had sort of dominated the whole scenario, and then religion was sort of subdued and overthrown, and science grew. But now somehow the balance again has swung in favor of science, and we are now we stand today in a position where we sort of ridicule religion, which again is not true. There has to be a sort of balance. We need to respect each other, and that is the way forward. Illness is a spiritual event. It grasps person by the soul and by the body and disturbs them both. It raises troubling questions of a transcendental nature about meaning, value, and relationships. See, remember those times when you fall sick, when you fall ill, or when you're hospitalized, and suddenly you see your life slows down. Your priorities keep on changing at that point of time. Rather than focusing on outward things, you look for things which bring about a sense of meaning and purpose in your life at that point of time. You would rather appreciate your loved one, maybe it could be your husband or your wife or your mother or father, sitting by your bedside, holding your hand, talking softly to you, or, gently ruffling your hair with their hands. That gives you a sense of meaning and pleasure at those points of time. And often you might even choose to think about why is this happening to me at this point of time? What did I do to deserve such a fate? And so on and so forth. So meanings, values, and these things keep changing as time progresses, especially during illness. And this here, you see, was a photograph taken of one of my patients. You see the patient is sitting on the bed, and that is his son who is offering him a glass of water. And in the foreground is his wife, I mean the son's wife, offering a small bowl of soup to the patient. But what is of importance is the background. If you see in the background, you will see certain figures. One is a religious figure of a god, and then you see certain photographs of the family, of the extended family. So at these times, these are the things which bring about a sense of meaning and purpose. So it's not only about God, religion, but it's also about other things like family, relationships. Those are the things which brings about a sense of meaning and purpose in life, especially when you are dealing with illness, sickness, death, and dying. The physician's own belief system, whether spiritual, religious, or none, affects medical decision making consciously or unconsciously. And this is so very true, this statement. I was a very strong atheist till about 2011, till certain events literally forced me to, look at religion in a different view. And I am a very strong, advocate of religiosity and spirituality today. So how I used to make decisions about my patients when I was a non-believer, and how I make choices or decisions for my patients and their families today that I am a believer, definitely I can understand the difference. My sense of compassion has increased many hundredfold over the years. So the physician's own belief system, and not only it doesn't only apply to the physician, it would apply to all professionals who are practicing palliative care, be it a volunteer, be it a physiotherapist, be it a nurse, be it anybody in the field of palliative care. So your own belief system, whether you actually believe in the concept of religiosity or spirituality, you might choose to be religious or not, that is your own choice. But then spirituality is something which is already inbuilt into your system. That is the inbuilt software, which you cannot erase. All of us, barring none, are spiritual. But all of us are not religious. You might choose to be religious or not. That is your own choice. But all of us are definitely spiritual beings. Now, visible light covers only 2% of the electromagnetic spectrum. So what we are seeing as light is just 2%. That doesn't mean that 98% of the light is not present. 98% of the light is also present. The only thing is that we cannot see it. Just because we cannot see it doesn't mean that it doesn't exist. It does exist, only that we can't see it. Similarly, there are so many things which are happening in and around us, which we can't see or we choose not to believe it, or we choose to ignore it. But that doesn't take that thing away. That doesn't make the thing disappear. Like if you talk of religion, now this particular figure is that of Vishnu, one of the avatars of Vishnu, which we call the Varaha avatar. Now this figure would be, say, at least 5,000 years old, if not more. Now what is interesting is the globe which the Varaha avatar is carrying on the snout. Now this globe, if you see, this is the figure of the earth. You can see. And now if you reflect back, it was just about 300 years, only 300 years back, that the Western civilization could actually prove that the earth was round. But if you again now reflect back on this photograph, on this picture, which is more than 5,000 years old, you would know that our ancestors already knew 5,000 years back that the earth was actually spherical. So what I mean to say is that we need to be respectful of our values, of our culture, of our old beliefs. Just because somebody believes in something or performs a ritual, it could be any ritual, like blessing somebody, or a ritual of it could be any ritual, like, like you give Ganga Jal to a dying person. That's a ritual. You might laugh at it, you might scoff at it, but there would be some reasoning behind it, which today we are probably not aware of. It's a grievous mistake to keep a wall of separation between medicine and religion. There is a division of labor, but a unity of spirit. The act of healing is the highest form of imitatio Dei. Healing. That is what I say, that we need to be healers and not merely treaters. What most of the physicians today are, they are treaters. They just treat the physical body. We are not just limited to our physical bodies, are we? We need to be healers. We need to heal the person. It is just not about the body, but it is also about healing the mind and the soul. And this little girl was one of my greatest teachers. If you see this photograph in the forefront here, you can notice this large tumor on her arm. And she used to come with her mother to my clinic. And every day she would just come and sit quietly. She wouldn't talk. She wouldn't even look up at me. She would just keep on looking at the floor, and that's about it. So on the third visit, I decided that today, definitely come what may, I have to communicate with her, a good communication. So I purchased this huge box of chocolates and gave it to her. And then I kept sitting very quietly just next to her. And after a long time, she actually looked up to me. And those were the most beautiful pair of eyes that I've ever seen till date. And after she looked up to me, I asked her, "Are you in pain? Why do you cry so much?" And what she told me was something which I had never expected. She told me that I'm not crying for my pain, but I feel sad when my mother looks up at me and starts crying. So that was her spirituality out there, because her mother's crying for her gave her a sense of meaning. She wasn't crying for herself. This little girl used to be hurt when her mother cried for her. And that was her spirituality, and that was her sense of compassion. Such a beautiful teaching it was for me. Now, the American Cancer Society states that the available scientific evidence does not support claims that faith healing can actually cure physical ailments. Okay. But if I replace the term faith healing by chemotherapy, for example, so that is also true. Available scientific evidence does not support claims that chemotherapy can actually cure physical ailments. Is chemotherapy 100% effective? Is radiotherapy 100% effective? It is not. So how can you just blindly state that faith healing is not effective? Faith healing can be effective. Compassion can be effective. It is not treatment. It is the art of healing. Now, coming to religion, what exactly is religion? Religion comes from the Latin word religare, which means to bind together. So it's a structured belief system that addresses universal spiritual questions. right? It is corporate, it's group based. That is, suppose 10 people get together and they say, okay, we will follow these rules and regulations. We will worship this particular God. And so we call ourselves X religion, and then you form a religion. So religion basically is structured, it's organized. You have a set of rules, regulations, do's, not to do's, so on and so forth. That is religion. Okay. So it is basically man-made. We make it. It is more of a societal process. But what is spirituality? Spirituality gives meaning and purpose to life. So anything which brings about a sense of meaning and purpose to your own life is your spirituality. It could be praying to God. It could be just watching a beautiful flower bloom. It could be watching your little child's smile at you. Anything which gives you a sense of meaning and pleasure. And what your spirituality is today could actually change tomorrow. Tomorrow, you could be more spiritually attached to your relatives or your wife or so on and so forth. It could change. So what we need to remember is that not all are religious, but all are spiritual. We are spiritual beings. We need to understand that. All of us are spiritual, barring none. So this was another example of what spirituality means. So this gentleman who is sitting up, propped up, he was suffering from lung cancer and pretty advanced lung cancer. He was in pain, physical pain, but it was very well controlled. But there was a sense of dread in him. There was a sense of insecurity always with this person, to the extent that this is his wife. Now, this is his daughter, but the daughter was married and stayed away in a different house, and he had a son. The son was staying away from him, separated. So this man was so insecure that his wife couldn't actually use the washroom also without closing the door. You know, when his wife had to use the washroom, he used to insist, no, don't close the door, keep the door open. I want to be in constant, visual contact with you. That was his state. He was so insecure. And then gradually we tried to find out the reason for his insecurity. And then we gradually understood that his son had separated from him. Now, this gentleman knew that he was going to die very soon. And in Hinduism, it is said that if you have a son, then the son should actually light the pyre. That is, the son should start the cremation process of the father. That is how one gets liberation. This is the religious belief. And so this gentleman was so very anxious, because he knew that his son had already fought with him and son was staying away. So he wanted his son to be back, because he was so scared that if my son doesn't perform my last rites when I am dead, what will happen to my soul? So that was his spirituality. That was his concern. And in this particular case, you wouldn't be using painkillers or say morphine or some other drugs like, gabapentin or pregabalin. That wouldn't help here. Would drugs help in this case? Not at all. What this man needed was the presence of his son. So we went, talked to his son. His son agreed. Son came back to the house. There was a reconciliation. And then the anxiety disappeared. And this gentleman died about a month and a half after his son came back. But he died a good death. And that is what matters. Religion and religious traditions serve two main prime functions. The first is to provide a set of core beliefs about life events. Core beliefs about life events, like why am I suffering? Or why is this happening to me? So many a times religion, provided you're religious, that religion could have some answers as to, justify why is this happening to you. And the second is establishment of an ethical foundation for clinical decision making. Like, what would you do in such a circumstance, right? So medically speaking, how would your decision be tempered? Would it be tempered just by scientific evidence, or would you take into religion? Would you take into focus religion, the social culture, the social and cultural aspects also? So that is the way forward, actually. So religion helps in clinical decision making also. What is the other role of religion? It helps you to cope with stress. 9 out of 10 hospitalized patients used religion to cope in a study. 9 out of 10, huge, 90%. Over 40% says it keeps them going. It acts as a buffer against depression and speeds recovery from emotional disturbance. It is associated with positive emotions and a good quality of life. It is related to lower rates of alcoholism, drugs, crime, and better school grades, actually. So it makes a sense to, teach religion to your children. It's related to healthier lifestyles and fewer risky behaviors. So all thumbs up mainly. So it's good to be religious, but it's bad to be a fanatic. Your religion, all religions teach good things. Let us pick up the good flowers instead of the rotten fruits. Use of fewer healthcare services. Actually, if you're religious, you have lower rates of hospitalization and need for long-term care. There is greater marital stability, enhanced family relationships, and you get more social support as well, because your own religious support groups would be formed. Now, the most important question: does religious attendance prolong survival? If you're religious, would you survive for a longer period of time? And yes, the paper by Harold Koenig in Gerontology 1999 clearly concluded by saying that older adults, particularly women who attend religious services at least once a week, appear to have a survival advantage over those attending less frequently. And this was highly statistically significant, this study. So if you're religious, you survive for a longer period of time. Another thumbs up. If you're religious, you have less stress-related medical conditions like cardiovascular accidents, strokes, hypertension, metabolic disorders, greater longevity, 7 to 10 years of additional life. 7 to 10 years, that's a huge increase in your life expectancy. It slows progression of cognitive impairment, actually, and less functional disability with aging and faster functional recovery after surgery. So it makes sense, actually, incorporating religion. So bringing together religion and science in the same platform is mutually more agreeable. Coping. Religion helps in coping, efforts to understand and deal with life stressors in ways related to the sacred. Because, see, all of us suffer. There is nobody sitting in this room listening to the lecture who has not suffered, isn't it? All of you have suffered. Now, suffering has to have a sense of meaning. There should be some justification to the suffering. If your suffering is without justification, you will continue to suffer more and more. So, but if you find a sense of justification to your suffering, then that suffering is reduced to quite an extent. And religion helps you to bring about that sense of meaning to your suffering. It serves multiple functions like search for meaning, identity, intimacy, control, right? So this is just a minute. Yeah. And this was another of my patients. And this picture was taken, I think, just a few days before she finally passed out. And she was suffering. She was in suffering, and we could use religion to quite an extent to help mitigate her suffering. Every religion has their own set of rules, regulations, explanations. So that, and if you're religious, so that makes life so easier, you know. Because if there is suffering, there is also happiness. And religion can help you transcend that little bridge. transform your suffering into a sense of meaning, and then that meaning can lead you towards happiness and understanding. Now, this was another patient of mine, and this elderly lady, you see, and she's holding up a little child. This is her great-granddaughter. And if you look carefully, this is her daughter sitting, and she had a huge ovarian tumor. Her legs are edematous, swelling in the legs, huge ovarian tumor. And she came all the way from Agartala in Tripura. She traveled all the way to be with her daughter. Her daughter was in Calcutta at that point of time. You know why? She came all the way to visit her daughter because she knew that she was dying. And her only wish was to hold her grandchild in her arms before she finally died. Because that was her spirituality. You know, holding her grandchild in her arm before she died would give her a sense of meaning and purpose to her life. So we could, by good palliative care, we could make that happen. We could, make her comfortable enough and extend her life to that extent so that she could have her wish fulfilled. And just a few days after her daughter gave birth to her grandchild, she could hold the grandchild in her hands, in her arms, and a few days later she passed away. But then that was a good death again for her, because she could achieve what she strived for. Now, there are certain behaviors that erode patient dignity, like relationships of inequality or being treated like an object or without respect. Because see, at the end of, when you enter the last road, the end of the road, that is when you go to your last days of life, all you have left is your dignity. And if somebody tries to take your dignity also away, then that results in a lot of suffering. So that is something which we should not do. We should practice compassion at that particular point of time. If the wishes are not honored, or loss of control over body functions, loss of ability to choose. Suppose the patient, so many times I've seen so many patients who are in the critical care units, they literally beg and plead that, please, I want to go back home. But the relatives refuse to take them back home. They have their own reasons. It could be social reasons. It could be so many other reasons, It could be selfish love. Selfish love. Yeah, I want my father to be alive at all costs. No, at all costs means that I don't care whether he's suffering or not, whether he's on ventilator or not. I want him to be alive. Why? Because if he's alive, then I'll be happy. So basically, my love is selfish. I'm doing it for my sake. I'm not doing it for my father's sake. I'm doing it for my own sake. And that is something which should not be happening. We need to respect the choice of the patient, because suffering is the patient's suffering. Yeah, I agree, the family also suffers, but it is primarily all about the patient, isn't it? In this whole movie of palliative care, the patient is the hero. The family is the heroine. And what are you, doctors and nurses? Basically, we are all comedians. So we come back in the stage. So we need to focus on the hero and heroine first. Okay. Dying in pain and alone or in isolation, loss of meaning and purpose in life. So these are things which we need to address. Now, what are the characteristics of spiritual suffering? How would we actually know that our patient is having spiritual pain or religious pain? Pain, constant and chronic. You are giving the best possible pain medications in the highest possible doses, but still the patient comes and tells you, no, doctor, I still am having pain. So something which you can't explain scientifically, then you need to think spiritually. Presence of insomnia, withdrawal, depression, presence of guilt or self-loathing, that I am no good, I am basically a very bad person, and that is why I am having all this suffering. So this self-loathing, presence of conflict, fights with the family, with the palliative care team, with the friends, a sense of hopelessness, lack of sense of humor, unforgivingness, presence of despair, fear, dread. So all these features, when either all or some isolated features are present in a patient, immediately you should think that perhaps it is spiritual pain or spiritual suffering that we are dealing with. Because all of us, all human beings, have certain universal spiritual and existential needs. The need for love and authentic connection. Who doesn't want love? All of us want love because that is our true nature. The nature of our soul is the nature of love. And that is why whatever activity we do in our life, if you reflect on it, whatever we do, why do you do it? You do it for happiness. All our life, we are doing things to seek happiness. Whatever you're doing, you just reflect on it. The base is because you want happiness, right? Because that is our true nature, the nature of the soul. The need to understand and transcend suffering, the hope to find a refuge or a source of peace, the need to find a meaning in life. These are the basic needs, universal spiritual and existential needs. And this here is my guru in palliative care, Professor Uchak from Poland. And he's with one of our patients who again is holding her great granddaughter because this is what she had wanted to do before she died. So now the question arises is that will we die in a manner consistent with the way we lived, which respects our personal values, spiritual beliefs, cultural background, and preserves our dignity? Are you really going to die that way? Or are you going to die in a large corporate hospital in the ICU, alone, undignified, painful deaths? What type of death are you going to die? And what are you doing about it? What are you exactly doing to die a dignified death? Have you made any investment for your death and dying? No, think about it. So coming to the principles of spiritual care, spirituality is an essential component of each person. It's an ongoing issue. As I said, spiritual concerns can keep changing from time to time and evolving. Demonstrate respect for the patient values, autonomy, vulnerability. Do not impose, this is very important, do not impose your own views or do not impose your own religion upon others, because the dying person is very vulnerable. At this point of time, please do not impose your thoughts, your rules, your regulations on the dying person. You need to understand yourself, because in this branch of palliative care, we can all teach you palliative care, but we cannot make you good palliative care physicians or palliative care professionals. To be a good palliative care professional, you need only one quality. Whether you understand theory or not is secondary, but the primary quality to be a good palliative care professional is that you need to be a compassionate person. Compassion. And that is the only quality I look for when I train my students. So you need to know yourself. So physician, heal thyself. So even I took my own spiritual journey to understand myself. I diverged into religion. I looked inward. I tried to heal myself. And only when I could understand myself, and only when I could understand my own sense of compassion, could I, transform those things to others. So everybody has a spiritual journey to travel. And this is again our hospice, where we also conduct retreat sessions on self-care. Because everybody during, when you're sharing other people's suffering every day, day by day, that suffering sort of builds up within you. And you also need time to heal. And this is self-healing, burnout. Otherwise, you would suffer from burnout. And this is a clinical psychologist who had come all the way from Australia to our center to participate in our retreat session of healing, self-healing. So yes, as I said before, that in palliative care, even if you're working in resource-poor settings or in resource-rich settings, you always have resources with you. Our inherent spiritual resources, like the capacity for love and authentic connection, to understand and transcend suffering, to find a refuge or source of peace, and to find meaning in life. And this was another of my patients. This was in the outskirts of Calcutta. And whenever I would get up to leave her, take leave of her, she would immediately grasp my hands and she would refuse to let go of me. She would tell me that, sit, please sit for some more time. And here is another, you would always find evidence of, you would always find evidence of spirituality somewhere or the other. This was a very young boy who was suffering from advanced malignancy. And you see in the background, again, he has a religious figure out there, the religious symbol out there, the symbol of a Trishul. So it's all around. If you actually look for it, consciously, unconsciously, people always have it. Because religiosity is very important also. It acts as a big support in times of distress. This here was another patient of mine. You can see he has superior vena cava syndrome, puffed up faces and all. And he was a Muslim gentleman, again in his last days of life. But you see certain interesting things. If you see the close-up, this is the close-up now. You see the calendar out here, written in Urdu. But here again, you see certain books, which again have certain religious figures which are based on Hinduism. So it really doesn't matter during the last days of life. You don't stick to religion just for religion's sake. You stick to religion, or you take the help of religion to help you transcend your suffering, so that you use religion as a stepping stone so that you can get over your suffering. Now, coming to certain Hindu perspectives, this is Adi Guru Shankaracharya, and he had said that Jantunam Narajanma Durlabh Mata. In Hinduism, it is said that you have multiple births, so many births. Once you die, then you are reborn, and so on and so forth. And Adi Guru Shankaracharya had said that among so many births, it is the human birth which is most important. Right? Why is it important? Because amongst all the different types of living beings, be it animals, plants, or whatever, it is only the human form which has the power of contemplation, like thinking, right? So that power, which is right, which is wrong, what to do with my life, how can I make my life better, this ability is there only in the human beings, which is the spiritual part of our nature. This is called the spiritual part of our nature. And that is why he said, amongst the so many Jantu Nam Narajanma, Narajanma means the human birth, is Durlabh Mata, it is very rare. So make the best use of your human birth. Help others. Help transcend your suffering. In the Hindu perspectives, in the Bhagavad Gita, there are so many chapters, and especially chapter 8 of the Bhagavad Gita describes in various slokas how one should transcend suffering and even gives guidelines as to what one should do at the time of death. What exactly to do at the time of death. And this, there are ritualisms in every religion. This is a ritualism of giving Ganga Jal to the dying. So this is again a ritualism which we need to respect. Every religion has some ritualism which needs to be respected. Now coming to Islam. In Islam too, it said, when the believer is afflicted with pain, even that of a prick of a thorn or more, God forgives his sins and his wrongdoings are discarded as a tree sheds off its leaves. That is suffering. That means God is actually testing you with suffering. And be sure that Allah will help you transcend your suffering. In illness, seek Allah's help with patience and prayer. Increase remembrance of Allah to obtain peace. Ask for tawbah. Give more in charity. Read or listen to the Quran. These are certain Islam perspectives. So these things help us to form guidelines on which we can plan our care process. In the Christian faith, sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone, and the power of God can help. So again, says that have faith in me. Christ says, have faith in me. Come unto me. Now, there is a downside of religion also. So most studies which have explored the downside of religion have said that high religious coping received more aggressive end-of-life care. So at times, people who are more aggressive in their religious coping, they want more and more supportive care. This again was a photograph taken of a dying lady. You can see the dying lady is lying on the bed. And this is her daughter-in-law and this is her granddaughter. And these are our volunteers out here. And we were doing music therapy for her because she loved singing in her younger days. And as we went on playing the music at one particular point of time, she actually sat up on the bed, which she never did for the last 1 month. And she started singing with us. And tears of joy actually flowed down her cheeks. And that was meaning making. So that was her spirituality, because music was her spirituality. Music gave her a sense of meaning and purpose in life. So you never know whose spirituality is where. So how do I do it? It's fine that you have talked about spirituality and religiosity, but how do I do it? The first is you need to recognize the suffering. So understand that the other person is suffering. So for that, you need sympathy. You need to recognize suffering. Then you need to respond with feelings of empathy or responding. And then you have to bring in your compassion to do something, to how, now that I've recognized your suffering, now that I have felt your suffering, how can I help you overcome that suffering? That is your compassion, right? Shift from doing to simply being. It is not always that you have to do something. Your physical presence also is very important, right? Remain available and present. That is very important because the patient doesn't expect very much from you. The patient should be made to feel that you are there for him. This again was another patient of mine, and almost on the verge of dying. So what we can do is to transfer our positivity, our vibrations, our compassionate presence to the patient, so that suffering is transcended. And as Cassell had said, when physicians deconstruct suffering to its physical dimensions, while ignoring the psychological and spiritual pain, they not only fail to relieve suffering, but also compound the suffering. Because bodies do not suffer, the person suffers. The person within the body is suffering. Now, this here was another photograph which actually won an award also. And this gentleman was from the northern part of Bihar, very orthodox, very orthodox. That's why I said northern part of Bihar. And this is his wife, who is lying down on the bed with advanced malignancy, osteosarcoma. Basically, she had one leg amputated with just one leg. And that behind is the daughter-in-law. Now, in such an orthodox society, you see this gentleman is actually touching the leg of his wife. which he would never do in a conscious state. He would never do it in presence of all. We were sitting across, in front of outside people, he would never do. And in front of his daughter-in-law, he would rather die than do that, than touch the leg of his daughter. But the circumstances were such. We had just broken the news that his wife did not have much time left. And when we broke that news, you see the look on his face, the look of despair on his face. And unconsciously, his hand went out to the leg of his wife, as if he's trying to hold on to her. That no, 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 I'll not let you go. I'll not let you die. So that was his spirituality out there. Because his wife, it is not only the patient here who is suffering, it is the family also who is suffering. So you need to understand that and help the family out also. Basically, my passion is dealing with death, dying, and afterlife. I research into afterlife quite a lot. And end-of-life dreams and visions is something which I've worked a lot on. I've done my PhD in end-of-life dreams and visions and meaning making. And here again, you can see the look of fear in this lady's face. Advanced carcinoma of the cervix, and she couldn't sleep at all because she used to see dead people walking by. And you see the look of fear in her eyes. But using religion, using ritualism, we could calm her down. You see her appearance, her whole appearance as she's holding that Rudraksh mala and counting the beads. You can see her appearance is now very relaxed. So this was the study, significance of end-of-life dreams and visions. Here was, I'll give you another example. And this was a young boy who had spent all his life running from hospital to hospital, advanced case of lymphoma. And so he had never got the chance to attend school. So it was his wish that when he was referred to us, he was already in a pretty advanced state of malignancy. So he always wanted to attend a school. So we talked to the school, to the principal of a local nursery, and she agreed that, okay, you send him to the school for a 1 hour or 2 hours like that. So he couldn't walk also. So he would sit on his wheelchair, and we brought him this huge watch, which he used to wear. And then we used to give him a big tiffin box. He used to take that tiffin box, he used to go to school, sit in the class in the last bench, and he used to eat his tiffin, and he used to make such beautiful paintings out there, crayon, because that gave him a sense of meaning in life. His spirituality was in attending school, right? So, and we have preserved his paintings, and he finally he could just attend school for about a week and a half. And after that, he became essentially bedbound. But that a week and a half was meaningful for him. We could bring about a sense of closure for him. And this is Dame Cicely Saunders. I'm sure you're aware of her. And she had propounded the concept of total pain, where it is not only the physical body which suffers, but you have social, psychological, and spiritual pain as well. So religious pain, what is religious pain? Feeling guilty over the violation of moral codes and values of his or her religious tradition. Say, oh, I've never been to church, I've never prayed, and that is why I've got my cancer. That is religious pain. And what is spiritual pain? Those who have concluded through their own self-judgment that there is something wrong with them at their core, that you might feel, no. Basically, I'm basically a very, very bad man. I have not taken care of my family. I have not taken care of my parents. So that is why I've got this cancer and I deserve it. That's all. So that is a spiritual pain. Okay. Another example. Now, this lady with this huge malignancy, huge multiple growths, she used to live in a small village, in a small hut, and she had her extended family. And in spite of this big tumors, we treated her physical pain. So she did not have any physical pain, but then she would always be, sort of depressed. So we tried to find out what was the cause of her depression. She always used to be depressed and says, "Oh, this is my fate," and all those things. So finally, we found out that she had a kitchen garden and she had lovingly tended to that kitchen garden, right? And every afternoon, monkeys would come to, try to steal vegetables from that kitchen garden. And she would sit on the charpoy every afternoon with a bunch of stones and shoo away the monkeys. So her concern was that when I die, who is going to shoo away the monkeys? The monkeys will, after I die, the monkeys will come and destroy the vegetable garden, which I have so lovingly grown. That was her spirituality. And then we talked to her daughter-in-law, and her daughter-in-law promised that doesn't matter, I will definitely keep on looking after your kitchen garden. And only then she could die peacefully. So that was her spirituality. Her spirituality garden you can see in front. So that was her spirituality. Hope. Hope has been defined in the construct of terminal illness as the positive expectation for meaning attached to life events. Hope doesn't always mean that I will get over my illness. Hope could be that, yeah, I will die peacefully, or I will die without pain, or hope that my whole family is here to look after me, right? Or hope that I'll be born again. So as long as there is meaning, there is hope. So hope could be transformed into a sense of meaning. So as Dr. Charles Kaur said, help me. The patient initially, when he comes to you, he says, help me. Listen to me, because not only help is physical help. Then listen to me psychologically, listen to me as a person. Stay with me. That means give me your compassion. And then remember me when I'm gone. Thank you. And that is the end of our thing. And I would be happy to take any questions if there are anything.
Thank you, Dr. Abhijith. If there are any comments, questions, you can unmute yourself and talk, or you can put it in the chat box. Any questions or comments? I think Mr. Samir has something to add. Please go on, Samir.
Yes, hi, Doctor. Doctor, just reflecting on what you just said around spirituality as to how every being is spiritual, and that you have to just find out what matters to them the most and what gives them meaning, and then try to sort of fulfill, or at least attempt to get to fulfill what matters to them. And so on the definition part, the religious pain and the spiritual pain. So spiritual pain comes from, you said, from that someone believing that something is wrong at their core. So yeah, so the earlier, so I don't know whether I have a question, but I'm just trying to make sense of this whole thing, and that spiritual as being meaning making and as what matters the most, and trying to fulfill that what matters the most, and then pain being as something as being wrong with the core, and yeah, which are two different things. So if you could just clarify that.
Yeah, what Samir, isn't it?
Yeah.
Samir, the way you were actually putting forward your queries to me, or
Mhm.
basically to yourself,
Yeah.
you were basically exploring the queries in your own mind.
Yeah.
And I have been through your stages, Samir, and
Mhm.
I can correlate with your subtle sense of confusion also at time at this stage, and your sense of compassion is also coming out.
Mhm.
This is the ripe time for you to take your spiritual journey.
Mhm.
I don't know whether you're religious or not. If you're religious, you can follow the path of your religion, or
Mhm.
if you're not religious, you can undertake your spiritual journey, because this, when once you start having these type of questions which sort of disturb you as well as sometimes soothen you also, this is the time to take your own spiritual journey. Where, how, when, that your mind will tell you.
Mhm. Mhm. Mhm.
But everything just can't be explained by definitions and, break down
Mhm.
objectives and such things, because unless you are convinced from within, and these queries would have a unique connection with your own self. And once you understand your own self, only then the flower will begin to blossom. And then that fragrance can be distributed to your patients.
Yeah.
So you need to actually take that, as I said, one of the most important things in your own journey in palliative care is to understand yourself, to know yourself. That is one of the most important steps that every palliative care person has to cross. And you have to cross that step. How, when, it is very difficult for me to just put it in plain answers, because whatever answer I give would be probably theoretical or just pragmatical, that sort of thing. But I'm here, and you can always come back to me for any query. We are all here, and we can help you whichever way you want to, but you have to take the first step out there.
Yeah. And so on that, actually, I think of myself more as spiritual than religious, and I
So
do
fine,
have.
it's fine.
Yeah, I
You,
do have, like you said, I need to look into more into my own spiritual journey, which is, of course, which in being palliative care for some time, like 6-7 months now, I can surely say that having more spiritual orientation actually complements it makes your work easier working
absolutely,
with
absolutely.
patients, and yeah, so I do understand when you say, finding what matters most to them, and every being is spiritual in that sense. And yeah, I was just trying to get more closer understanding about someone believing that something is wrong with their spirit, like core, right?
No, I
So
mean, this is that
how-
I put it as a very gross example of making the audience understand the concept of spiritual pain. Those who are
Mhm.
not religious at all, those who have nothing to do with religion or are agnostics or atheists, for them, they still have suffering, isn't it? They can still suffer because all of us are spiritual. So that suffering would be related either to the family, or they could correlate with their own pets, or with the nature, or with within themselves. There could be so many angles to that, so many
Mhm.
connections. So it doesn't always have to be the so-called God. So the connection could be anywhere else. So anything, as I said, anything which gives you a sense of meaning and purpose in life.
Yeah,
It could
yeah,
be watching the sunshine. It could be nature. It could
yeah,
be your pet dog. So anything.
yeah.
So that is where your connection lies.
Perfect. Now I get at what you're saying. So it's spirituality is not it's in me. It's more of a something larger than me. So when you're talking about something larger than me, it's also that pet that will suppose I have a pet and I'm worried that after I'm gone, who will take care of that?
Exactly,
That's
exactly.
how it's like spiritual
Yeah,
distance. Yeah.
exactly. That's how it is. Hmm.
So there are some comments in the questions in the chat. Roshan Kumar asks, like, what kind made you change your thinking from atheist to believer towards God? As you mentioned before 2011, you were an atheist.
Yeah, there were certain events in my life which brought about a sense of suffering, a lot of suffering. And as I said, suffering, it is very important that we all suffer. And I often say that God blesses us by giving us suffering. God doesn't bless us by giving happiness. Because if God blessed us by giving happiness, then nobody would think of God further. It is only when God gives us suffering that we immediately, without even asking, we go to God. We think about God. We promise various things to God. So God gives us the challenges and then leaves it upon us whether we use that challenge to grow up in life or whether we choose to just wallow in sorrow. So it is totally up to us. So that is the power of suffering. So even I had suffering. Everybody has suffering in life. And sometimes that suffering would appear as a huge tidal wave and you think that you're going to drown. But if you can actually ride the wave, then you can see the rainbow beyond. And that is how it happens.
Another question from Ms. Musabiha. When a person is diagnosed with some disease, example cancer, they initially lose hope and stop praying. How to overcome that?
See, when they stop praying, that is because they become angry at God. They believe that, look, I have given you so much. I have been praying for you every day. I have been promising so many things to you. I have been donating so many things to you. But still, instead of this, see, you are a cheater now. You have cheated upon me and you have still given me cancer. So I'm angry at you and I will not this thing. When we are little children, often many times we are angry with our parents when they beat us. That doesn't mean that we have stopped loving them. We still love them, don't we? So angry, whom do you become angry with? With somebody you know, with somebody you have a connection with. So anger is a, twisted form of love, basically. So yeah, the anger comes out there and you stop praying, but you don't stop thinking. And these are the times when either you should have a religious figure like chaplains or somebody who's trained in spiritual care coming in, or a person or a palliative care personnel who's trained in spiritual care to come and bring about a sense of meaning out of that suffering. You have to explain why are you not praying? Why are you so angry? And gradually, once they start speaking, the pus comes out. Pus drains away, and then there is healing.
Another question from Ms. Maria Alice. She asks us, she says, like, thank you so much for the wonderful class. Could you please share more about the interdisciplinary teamwork on spirituality in India? All the professionals are trained to do and do listen the spiritual history or spiritual suffering. Do you have a spiritual care specialist in the healthcare team?
Sadly, in our country, this is an area which is most often overlooked. But in spite of being a doctor, I see it with a lot of respect. And actually, I walk the path. Instead of just merely talking the path, I've walked the path. And I have trained myself over the periods and I've understood suffering. And I have trained myself in various ritualisms also, which bring about a sense of meaning. Various ritualisms, sacrifices, ritualisms, dances, music, so many things are there. So many beautiful tools which are hardly used. So you need to actually, instead of just relying on designated pathways and this and that. Oh, I'll follow this protocol and that protocol. Follow the protocol of your heart. Start by yourself. Right. And then it's a beautiful world out there. And it is a very largely unexplored territory.
Mr. Samir has again raised his hands. Go on, Mr. Samir.
Yeah, I have just one more question. So when you were talking about, Doctor, when you were talking about anger, and this is so common, like why me, and why all of this is happening. I have been such a nice person. I have not done anything wrong, and why this is all happening to me? Why God punished me like that? So this is so common in this field. And so one way to sort of, I'm just thinking of what are the ways we can better hold space for this patients and the family members who are having these kind of spiritual distress. And as a counselor, I would listen, and like you said, let them talk and let the pus come out, and hold space for that anger that's there. Or so are there any other ways that you work around with spiritual distress, or is there anything more that can
Yeah,
be
you
done?
can use religion. Many attempts, like in Hinduism, you can explain it by the karma theory, right? I mean, to understand now, if you say blindly karma theory and say that you have done this in the past and that is why you're suffering now, it is not like that. It is not, so that would actually bring about more anger. So to understand anything and to bring it, for example, say the karma theory, it's got a lot of detailing inside. There are various types of karmas, and so that is why you need to undertake a training in religiosity also, in whichever religion you feel comfortable at pursuing, right? So you need to understand the whole vastness of the religion and provide hope. You need to pick up the flowers which give nectar, rather than pick up the dying flowers. So there are flowers all around. You have to be very, very careful which flowers you need to pick and which can give you a sense of hope. Right? So instead of destroying hope, so religion has a big role to play out there, and ritualisms, they help a lot. And ritualisms, I actually went down. There is a center about 30 kilometers away from Visakhapatnam, a place called Devipuram. I went and stayed there for 2 weeks, and I trained myself in ritualism also. What is the importance of ritualism? Every religion has some ritualistic practices. Now, whether those ritualistic practices are just fancy practices, or have they a sense of meaning and purpose? Do they convey a sense of meaning and purpose? They do convey a big sense of meaning and purpose. People can actually connect with those ritualistic practices and help them, and help transcend their suffering. There are so many tools to use.
Yeah, and so the whole purpose is to not, of course, the hope has taken, because of what's happening with the patients or families, like the hope is definitely affected because of that. But then it's about on to us to how we sort of reorient that hope and give a different meaning to that hope,
Exactly.
through rituals, or through through assuring them that there won't be pain, that there will be pain, but we'll try our best to manage that
Exactly.
pain.
That is the better way of putting it.
Yeah. So yeah, thank you so much.
We do have another question from Mr. Ahmad Montasir. The pupils who usually are in the front line of religious practice, the Maulana, priest, Purohit, have a little idea of palliative care, but often patients and caregivers want their involvement. Involving them ends up with recitation of verses more of the time, which literally shows little effects on the care of patients. How do you solve religious support and palliative care simultaneously in your practice?
See, you have to come to a balance. When you study any particular religion with a background of palliative care, you would understand that religion in a better way. This is what I have understood. That is basically, if you study any religion with a compassionate heart, that you want to do something for others, so because you are compassionate, you want to help them out, then it automatically turns into something beautiful, right? So as far as the religious figures, like be it a priest or a Maulana or a Pandit or whatever, they do not have any idea. Most of them in India do not have any idea about palliative care, and they are basically coming here because they are professionals. They are coming there for the commercial aspect. They're coming there for money, right? So we don't need such type of persons exactly, or rather what we need to do is we need to train those sort of persons in palliative care, so that they can better their care, so that they can give care in a better way. Or what the other way around is that we train ourselves into religion. We walk the path of religion also, which will make us a complete human being that way. So either way. So we need to strive a balance. There is nothing called right or wrong out here, but how it is just like breaking bad news, how you do it, how you break an egg, whether you smash it or you break it very gently so that the egg and the yolk are preserved. So how you do it is what matters.
Any other questions or comments? Ms. Hadasha have raised her hand. Please go on, ma'am.
Good evening, sir. It was a wonderful session. Sir, I have a doubt as to, I really like this whole concept that you're supporting your patient, whatever is giving them meaning, you're trying to find that out and you're sorting their problems. But I have a question, like when you're in a team, and I don't think so usually ऐसा होता है कि in the team everyone supports the whole idea of spirituality and finding meaning in that particular segment of life, and then helping the patient in that segment. So does it ever happen like do char doctors in a team and one of them supports the spirituality? Yeah, I am a psychologist, let's say, when I am there in a team and I suggest something like that, and the others completely refute the idea. No, it's not necessary that we do all of that, or we take so much pains to find out what is actually bothering them. And the family might only then focus on the physical aspect of the suffering, and then they don't go beyond that. They're like, the other doctors are saying that this medication is okay, this treatment is going on, so why are you poking more into our lives? So if that sort of a situation happens, how should we deal with it? Because no, I don't think so, because I think at least in psychologists sometimes we are told ki ekdam personal cheezon ko you shouldn't be poking, it doesn't seem professional. So how do we maintain a balance where you seem, that you know what you're doing, and then you do it in such a way that it comes out in a, it doesn't look like बाकी priest या मौलाना नहीं है, हम doctors हैं या हम psychologists हैं, we know what we are doing in both areas. How do we balance that?
See, if it's a infight between the team members, and you really feel that this person could do with some spiritual religious help, I would say go ahead, or you walk out of the team. Because it's just like that, bucket of crabs. The crab which tries to get out, the rest of them try to pull it down. So if your team is like that, I would strongly advise you to get out of the team as fast as possible. I have done that a couple of times in situations outside where I had been to train people. Second, what is important is group meetings also. Once you see the patient come back, then we need to sit down together, have a meeting as to the next plan of action, like a tumor board, right? So this is, you call it a spiritual board, right? And then you decide whether just a spiritual help is going to be enough, or you need a religious help also, or religious intervention also. This is about the team members. Second is, as far as the family is concerned, as I said, the family is the heroine. Hero कौन है? Patient है. So talk to the patient separately also. Insist on it that yes, I would like to talk to the patient alone for some time also. And then I will take your views also. So talk to the patient separately, talk to the family separately, both the views. And third, have everybody on the same this thing and talk to them. And if you feel that the patient is not happy talking to the family member, talking in front of the family members, or if it is a sort of ambivalent relationship going out there, then you need to sort of, respect the patient's wishes. The dignity of the patient and the privacy of the patient needs to be respected. So there is no clear-cut way of doing it, or clear-cut goals of doing it. But at the end of the day, I would again say, number one is that know yourself. Once you know yourself, second is follow your heart. Third, do not impose anything.
Also, one more question from Ms. Maria Alice. In your experience, how the interdisciplinary teams work on spirituality and in palliative care in India? In your opinion, do the nurses, doctors, psychologists, physical therapists, and other professionals consider spirituality as a vital sign and take time to listen patients and families' spiritual self?
Simple answer. If they are not doing it, then they don't know about it. They should be doing it. If they are not doing it, it's very sad. You impose yourself. Say that this is a very important part. Each component of total pain contributes to 25%. If you're just focusing on physical pain, then it is only 25%. Spiritual, 25. Cultural, 25. Social, 25. Then it becomes 100. Only when all the fingers are clenched, it becomes a fist. If one finger sticks out, it is broken. So that is the team approach again.
Thank you, Doctor. I think there are no more queries and comments from the participant side. I think we can wind up the session.
Thank you. Thank you all.
Thank you so much, Dr. Abhijith, for joining us today. Thank you for your valuable time and your patience to answer all these questions. Thank you all for joining us today. I have shared the feedback link with you all. Please go through it and kindly fill it up. We'll see you on the next session. Bye.